Do we have enough data at this stage to say conclusively that this variant is indeed less severe than Delta?
Not at this stage. We will see hospitalizations begin to rise in post-Christmas. So quite soon it will be there in terms of the real evidence to show that whether it is more severe and if we do have an increase in hospitalizations, or if many have proposed that the theory that it's spreading faster, therefore it may lose some of its virulence, keeps hold. I think the major fear, however, is that by that point, given all of the pressure that the NHS has been under for the past 2 years, NHS is not in the same place of resilience as it was in the beginning of the pandemic. So although we have vaccines and other tools, there are other aspects that we also need to consider, including having the lowest number of ICU beds and capacity across all of Western Europe.
Oksana, can we actually take South Africa as a template, or does the virus, act differently? Like, what data are you looking at to understand whether it's less severe than Delta?
So there has been a lot of speculation coming out of the fact that South Africa has fared well with Omicron. So they're not seeing that huge peak in hospitalizations. And that's potentially for two reasons. One being that they had quite a lot of exposure in the other waves as well. So if we're looking at even Delta, Alpha, et cetera. So there's already, let's say, built up immunity more so than in the UK from that perspective. And they have a younger population. So that's also going to mean that less risk of hospitalization in general. So it can be difficult to extrapolate, particularly now, because there are many more variables to consider. We don't have a blank slate where, again, starting in the beginning of the pandemic, there were no vaccines available anywhere. So it perhaps it's easier to make those types of comparisons. But it is tricky now to make that assumption here in the UK. And the chief medical officer, Professor Chris Whitty, made that very clear in the last number 10 press conference.
Oksana, what do you make of Israel coming out with its fourth shot? Is that the template that's going to be followed by other countries as the effects of the booster start to wane in the months ahead? Is a fourth shot now looking inevitable?
Well, I think that depending on what the next variant could be, we're looking at perhaps pharmaceutical companies tweaking on a yearly basis so that there is either multivalent vaccines, something that could identify various strains. So, for instance, with flu vaccine, you can have a mixed vaccine that works against different strains. And that research is happening right now. So until we get to a stage where those become available, we may need to look at top-up doses. And again, that will maybe pose a bit of a challenge in terms of acceptability amongst populations. But certainly I think everyone is on the same page that they want to get back to life as normal. And if that means looking at a yearly new vaccine, just as we have for flu, I think that people will be lining up to get it.
Oksana, when you look at some of the reports out there today in The Independent and other media, I think we also had something in Business Week. There's talk or chatter about a pill that would then be effective against all coronavirus. How far away would we be from something like that?
Well, hopefully that puts us in a position where we are in the last winter of making really difficult decisions in terms of protecting the healthcare system and damage done to businesses, because we already have available some antiviral medicines. Both Merck and Pfizer have come out with that. Currently, however, there is a supply problem, so it's not going to make much of an impact in the current Omicron wave, but will become more available in future, such that, again, we'll have a wider toolkit available to us and new types of medication that have wider recognition. And that stops the replication of the virus. It garbles up the DNA so that you don't have that same level of replication. We know with Omicron, it replicates 70 times faster in the upper airways compared to previous strains. And that's also thought to contribute towards its extremely high transmissibility. So I think it's around the corner, and it'll be one of the things that help us to get out of this mess.
Yeah, Oksana, some experts have come out in the last few days and said that, look, given the nature of Omicron and the new treatments coming down the pipe from the likes of Pfizer and Merck, that we're going to get to a point where this is going to be endemic sometime in the middle of next year. Endemic to the point where it's like more like a flu. Are we getting to that point? Are we getting close to the end of this? Are we looking at the end possibly in next year?
Well, we're definitely transitioning into it becoming endemic. And we're already seeing that with boosters, the number of cases that are asymptomatic or mild are increasing because the vaccine is what's muting the severity of symptoms. So that's why it's also been very difficult to unpick the data in terms of, is the strain itself more mild? Is this the effect of the vaccines themselves? And we see the data is looking pretty good. With booster shots, it's a reduction of hospitalization by 80%, which is what we're looking at, and brings it down towards the level of flu, certainly as more medications come out as well. So we're on that path, and it's looking again, like I said, probably the last hard winter due to COVID, unless, well, we won't go into that scenario, but let's make sure that everyone has access to vaccines globally.
Oksana, we'll keep the doom and gloom maybe for January 2022. I need to say also, I know it's frivolous, but we are like 3 days until Christmas, and someone in our producing team needs to send a picture of the room that Oksana's in, because I give it a 15 out of 10 and rate my room. It's a wonderful festive season.
It's the most Christmassy room, isn't it, that we've had?
Wonderful.
Fantastic. Getting us in the mood, and with some optimism there on the outlook for Omicron and the pandemic.